Well, in case you didn't know, today, the 10th of October, is World Mental Health Day, a day that was first observed in 1992 at the initiative by the World Federation of Mental Health. And this morning, we're joined by Dr. Shaheen Kader, who's here to dispel some of the many myths and stigmas that come along with, of course, people going to visit a psychologist or a psychiatrist in order to have some kind of consultation with regards to mental health and the kind of stresses that this life puts on us. And thank you once again for being here, Dr. Kader. So when someone does come and visit you at your psychiatric offices, can I call them that?
Yes, you may.
What usually happens? What's the very first steps that you take?
Well, the very first step is to establish a therapeutic alliance. So I'm very aware that our patients are quite anxious to actually consult a doctor, particularly with such a sensitive matter. So the first thing is to put them at ease and make them feel comfortable, to let them know that it's a safe space, that it's completely confidential, and to allow them to be honest with what they're actually going through.
Yeah.
Often, for people to reveal some of the more sensitive information, you have to have a relationship that's a trusting one. So that's probably the first step, just to ensure that they're comfortable, that they're safe, that they're at ease, and that they've made the right decision to actually get assistance for the problem that they're having.
Yeah. And then usually what does a consultation session entail?
Well, psychiatry is basically the study of mental diseases, and it involves understanding how the biological system and the psychological system, as well as the social system, affects mental illnesses and behavior. So the assessment of the psychiatric assessment involves a clinical examination, which is normally a physical examination of the body, particularly with regards to the neurological system.
Yeah.
But it also involves a psychiatric interview, which is taking a history of the symptoms that that individual might be suffering with.
So if you feel yourself struggling with certain issues and stresses in your life, how long from the first consultation with you until you as a professional can say to me, well, you've got something that is pretty serious that needs to be dealt with, and it's not just a normal everyday stress?
Well, often you can actually establish that within the very first consultation.
Okay.
Sometimes it requires requires further investigation that might involve certain blood tests or blood investigations, or possibly even some neuroimaging studies or scans of the brain.
Yeah.
It may also involve other psychological projective tests. So those kind of things may result in a diagnosis being delayed. Often it is required for us to gather information from people who know you very well to determine whether your behavior is normal for yourself, or whether there has been a change in what you are as you have been before.
Yeah.
So that often involves getting to contact with family or friends.
Yeah. So what happens though if I'm not diagnosed with any sort of mental disorder and you're considered to be normal from a psychiatric or a psychological perspective? What can then be the benefits of you going to see a psychiatrist on the regular?
Well, the concept of normal is a very controversial and controversial one.
Yeah.
We need to establish rather than normal, but being mentally well. It can be quite discriminating to call someone normal, then everybody else is abnormal. So it's really important for you to establish how you can improve your mental well-being. So there is significant benefit from actually consulting a psychiatrist or a psychologist just to establish where you are at and to help you improve on your own ability to cope with daily lives and stresses.
And just very quickly, your last piece of advice or words of advice during this World Mental Health Awareness Day today and, of course, during the month.
Get help. There is plenty of services out there. If you know anybody who is suffering from some kind of emotional or stressful situation, direct them to a psychiatrist or to a psychologist. And this can be established by looking at the South African Depression and Anxiety Group website, and you'll get plenty of information and contact details for all of those sort of disorders.
Dr. Kader, thank you very much for being here.
It's been an absolute pleasure. Thank you.
Much appreciated. Of course, there we have some wise words of advice. But of course, also, if you're looking to kind of unwind, switch off the mind a little bit after the stresses of this year, well, there's an opportunity for you to travel.